This is Robin Thorne, and this is HIT220, and I am doing my live media. Please bear with me. I'm not tech savvy, but this is for my assignment, and so I'm going to do the best I can. So the media that I chose, or the healthcare fraud that I chose, was the one that the doctors were charged in fraud and opioid takedown in Texas. And so there were 16 doctors and medical professionals who were charged in this fraud, and it was called the opioid takedown in Texas. And it also included online breach, where 6 doctors and 7 pharmacists were also charged, and 58 charged for, I think 16 medical professionals were charged, including 6 doctors and 7 pharmacists among those medical professionals. Healthcare fraud enforcement operation across the state of Texas resulted in charges against 58 people. Charges were brought against individuals in all 4 federal districts in Texas and their alleged involvement in a number of Medicare and Medicare fraud schemes and networks of so-called pill mill clinics. The charges resulted from schemes billing Medicare, Medicaid, TRICARE, and the Department of Labor office workers' compensation programs and private insurance companies for medically unnecessary prescription drugs and compounded medications that often were never even purchased in or distributed to beneficiaries. Dozens of people in a trafficking network responsible for diverting over 23 million oxycodone and hydrocodone and cortisoprodol pills. The pharmacy allegedly dispensed these substances on counterfeit prescription pads from doctors whose identities had been stolen. Wow. And also there were runners who brought the illegitimate prescriptions to them to be filled for cash only, and all while charging nearly 5 times the market value for equivalent oxycodone and hydrocodone prescriptions. So the 3 breached an EHR system to steal protected health information and personally identifiable information belonging to patients. The information that was stolen was repackaged in the form of false fraudulent physician orders and sold to durable medical equipment providers and contractors. And the Department of Justice said that within approximately 8 months, the 3 obtained more than $1.4 million in proceeds from the sale of the stolen information. This was baffling to me. It was interesting story. I read a few of them that were suggested to us from a professor, and this one was very interesting to me because, wow, it's just, first of all, we have an opioid addiction crisis now in the country, and then to be using this and being fraudulent and using this, it really was baffling to me. But anyway, this is my first media experience. And I just hope that I did okay, and I hope that I communicated the information effectively, and I answered the questions that were needed for this assignment. This is Robin Thorne, and I thank you again for listening. Have a wonderful evening.